Assalamu alaikum. My name is Kuratulan and I am from group number 7. My roll number is BP1650176. The topic which I am presenting here is post-operative nausea and vomiting. So before understanding the case, I would like to highlight some points that is related to post-operative nausea and vomiting. So, what do you mean by nausea? It is an unpleasant sensation referred to a desire to vomit not to associated with expulsive muscular movement. It means nausea is a diffuse sensation of unease and discomfort and perceived as an urge to vomit. And vomiting or throwing up is a forceful discharge of stomach contents. It can be one-time event linked to something that doesn't settle right in the stomach. So, vomiting is basically expelling what is present in our stomach through the mouth. The vomiting center of the brain. We need to understand that how vomiting is initiated, what is the phenomena behind the vomiting. So, the fourth ventricle of the brain hosts the vomiting center. The floor of the fourth ventricle contains an area which is known as chemoreceptor trigger zone. When this area, chemoreceptor trigger zone, is stimulated, the vomiting may occur. So, this chemoreceptor trigger zone may be stimulated by any of the neurotransmitters such like dopamine, serotonin, opioids, acetylcholine. When any of these receptors stimulated the CTZ, then vomiting may cause. Now, I would like to tell you about the post-operative nausea and vomiting. So, post-operative nausea and vomiting is a recurrent problem in the field of an anesthetic. It is usually defined as nausea, retching, or vomiting within 24 hours of surgery and affects 20 to 30% of patients. So, PONV is a phenomena of nausea, vomiting, or retching by a patient in a PACU unit, that is post anesthesia care unit, within 24 hours following a surgical procedure. Now there are various causes of the PONV, just like age, gender, past history. In case of age, the patient who is adult, he or she is at higher risk of having post-operative nausea and vomiting. Similarly, in case of gender, the female are at higher risk of this post-operative nausea and vomiting as compared to men. If the patient has any past history like motion sickness or surgical procedure, then the person is also at higher risk, or he is or she is more susceptible to the post-operative nausea and vomiting. In case of cancer chemotherapy, if the patient is receiving any chemotherapeutic drug or radiotherapy, he will likely to suffer more PONV symptoms as well. Anesthetic and surgical factors. Sometimes certain types of anesthetic agents like inhaled gases, medications like morphine, and some surgical factors like surgery, abdominal surgery, surgery around eyes, ear, nose. These all are increases the risk of you getting nausea and vomiting afterwards. Now the case which I am presenting here is patient A. She is 40-year-old woman and having 93 kg weight, and she is scheduled for a laparoscopic cholecystectomy, and the scheduled duration of her surgery is 4 hours. She has no medical history of hypertension, motion sickness, and she is also a non-smoker as well. But her sister-in-law had a severe nausea and vomiting after the surgical procedure last year, so that's why patient is worried that all these things might happen to her. So we need to find out what is patient at risk of having post-operative nausea and vomiting, and what we can do to reduce her risk, and how, if the symptoms occur, we can treat it. Now comes to sub note. In subjective, patient weight is 93 kg, patient age is 48 years old, patient gender is female, and patient have no history of hypertension, no history of motion sickness. She don't have any surgery before, and she is also non-smoker. But her sister-in-law had severe nausea and vomiting after the surgical procedure. Now objective, patient A is scheduled for a laparoscopic cholecystectomy for 4 hours. Now, to find the risk factors of patient having post-operative nausea and vomiting, and we need to find preventive measures to reduce patient A symptoms and treatment if patient shows signs and symptoms of post-operative nausea and vomiting. So there are several factors like patient factors, surgical factor, and pharmacology factors that might increase the risk of post-operative nausea and vomiting. I will discuss one by one. That is, in case of patient A, the patient factor is smoking. As she is non-smoker, so it is she is at higher risk of post-operative nausea and vomiting because smoking appears to be protective in case of nausea and vomiting. In case of surgical factor, the midline laparotomy used in patient's A operation stimulates the vagus nerve because of which also the emetogenic effect will produce and the patient feel nausea and vomiting. Also the surgery time is longer, that is 4 hours, further increasing the risk of post-operative nausea and vomiting. And in case of pharmacological factors, unfortunately in the case of patient A, regional anesthesia cannot be used. Instead, general anesthesia will be used, which further increases the chances of post-operative nausea and vomiting. Now, what is regional and general anesthesia? The regional anesthesia numbs a larger but still limited part of the body and does not make the person fully unconscious. Whereas in case of general anesthesia, person is completely unconscious and don't feel any pain. So as here we cannot use regional anesthesia, that's why the chances of PONV will further increase. Now plan. The plan is it is better to prevent the post-operative nausea and vomiting than to treat the symptoms. So first we will treat the patient A with the non-pharmacologic treatment. The non-pharmacologic treatment options include these methods required prior to surgery and have been shown to be very effective, and we could treat the patient A with TENS machine treatment and acupressure at the P6 wrist point. Now, TENS machine treatment, it is transcutaneous electrical nerve stimulation device and it provides pain relief of abdomen and muscles involving the use of mild electric current, thus having no side effect. Whereas acupressure, this point is located on inner arm near wrist. Doing acupressure on this point can help release nausea and vomiting related to surgery and chemotherapy. So by treating the patient with non-pharmacologic treatment, we can reduce the risk of post-operative nausea and vomiting as this non-pharmacologic treatment options associated with less side effects. Now in case of pharmacologic treatment options, if the patient doesn't respond to the non-pharmacologic treatment option, we can also go towards the pharmacologic treatment option. In case of pharmacologic treatment option, we have different drugs that will depend upon the severity of the disease. Now, if the in case of patient A, she has approximately 4 risk factors like she gender, she is a female, she is non-smoker and longer surgical time and anesthesia. So patient A has moderate to high risk of PONV. So the combination of serotonin antagonist and dexamethasone would be a good choice of therapy. Dexamethasone and serotonin antagonist. In case of serotonin antagonist, we have ondansetron. We are using this because dexamethasone and ondansetron associated with less side effect and have like mild headache, and their efficacy profile is much higher and they are relatively safe. That's why we are using this combination of these two drugs. So dexamethasone will be used in 4 to 10 milligram at the start of induction of anesthesia, whereas serotonin antagonist, which is ondansetron, 4 to 8 milligram IV at the end of surgery. Dexamethasone we are giving at the start because it produced better result, produced best effect at the when administered before the surgery, whereas serotonin it produced best effect when it is administered after the surgery. Now, if there is no improvement within 30 minutes and its symptoms persist, then the patient A had a breakthrough of nausea and vomiting. Now, in this case, we will treat the patient A with next line of therapy, which is known as rescue medication. Now, rescue medication, these are the medication that provide intended relief symptoms immediately. it treats the symptoms very immediately. In these rescue medications, we have different drugs like droperidol, metoclopramide, but here we are using droperidol is a good choice for treating the patient A. We are using droperidol because it is also associated with very less side effects and it is very rapid acting drug. It treat the symptoms very immediately. The dose of the drug which we are using here is 0.625 to 1.25 IV at the end of surgery. Also, the general anesthetic technique can be replaced with the use of opioids either intra or post operatively. All these plan could be applied in order to minimize the risk of post operative nausea and vomiting and to treat the post operative nausea and vomiting. Now, it should be noted that if the patient has prolonged vomiting and it do not respond to combined or the rescue therapy, now we would like to consider the alternative causes of PUNV. There are some other causes like complications of the surgery, hypotension or hypoxemia, or there are some more underlying problems like intestinal obstruction during the surgery. We would like we need to consider all these factors because all these factors are also increase the risk of post-operative nausea and vomiting. In such cases, we will treat the patient with good IV hydration. We would need to provide the adequate oxygen to the patient properly. Now, if the patient is having hypotension before surgery, we should also need to consider it. If it is there is hypotension, we need to treat the patient then with epinephrine or with some other treatment. Now the patient A if is obese and is also overweight, that is 93 kg, so patient must fast before surgery, otherwise risk of getting nausea and vomiting would be higher after surgery, because if the patient has eaten something, the contents which are present in our stomach might lead to increased chances of post-operative nausea and vomiting. We need to note all these points and consider while treating the patient. Now, the drugs which we have used, there are also some interactions of these drugs like dexamethasone, which is an anti-inflammatory, antiemetic and immunosuppressive drug. The antiplatelet drugs such as clopidogrel and blood thinners such as warfarin can cause bleeding with dexamethasone. So we shouldn't give the dexamethasone drug along with antiplatelet drug or blood thinner drugs. In case of ondansetron, which is a serotonin antagonist, it works by blocking the release of serotonin in the gut and CNS, thus inhibiting the nausea and vomiting. Also, this ondansetron, when given along with apomorphine, it causes low BP and loss of consciousness. So we should avoid the ondansetron administration along with the apomorphine. At the end, I would like to conclude that persistent vomiting can result in dehydration, electrolyte imbalance, metabolic alkalosis, and also the oral administration of drugs, nutrition, and fluids may be delayed. So, vomiting also increase the risk of esophageal perforation, bleeding, and pulmonary aspiration. So, we need to consider all these factors, as it is important to consider the physiology, prevention, and treatment of MSS as well as the risk factors that make the PONV more common. So this is all, and thank you so much.